So I'm going to let you know, like, this is going to be a very triggering topic. This is about extreme abuse and medical kidnapping that can happen when we don't know our rights and we don't know our options and we don't really know the political context in which we're working with in the hospital. So this mom, she had had 6 previous births with no issues. She knew that she could do it herself. And like, she was like, I'm on number 7. I don't really need much for prenatal care. I've got this. My body works. She hired a doula and she was ready to go. And then what happened is that unfortunately her baby came a little bit too early. Her baby came at 36 weeks. So she realized she might need a little bit of extra help. So she chose to go to the hospital. Sadly, she didn't know this area. She had actually moved because she had had some issues with housing. Like, we've had a lot of floods in the area and even on the island. And so she came over and she was staying with a friend with her children. And so she didn't know what I know about this health authority and how to navigate that. And while she had a very strong advocate as a doula, she had just hired her. So her doula was not yet on call. So she actually went into the hospital and she did not have her doula. She just had her doula on the phone. They also wouldn't let the doula into the hospital because she was also not vaccinated fully. And we had issues around that in our healthcare as well. So she didn't have a doula for support. She did have a friend. But what happened is that she was birthing her baby, and that part was fine. But then she said she didn't want the vitamin K and she didn't want the eye ointment. Both practices of which there's evidence on both sides, but the eye ointment has been basically mandated where the care providers have to offer it. And this particular hospital also isn't used to moms having informed consent. We have a lot of problems with that within our health authority itself. But this particular hospital, I'm like, oh, you couldn't have gone to a worse one. Like, this is just awful. She also was profiled as a single mother who had multiple children, who was lower income. And so they basically started to ask questions around, like, are you a prostitute because you have so many kids? Are you doing drugs? And of course, she's never done drugs in her life, and she's not a prostitute. She was very young when she had her first baby. And then, like, she just kept having kids, and it was okay because she could take care of them, and she's a really good mom. And the things that this woman has been through, it was just like, my goodness, like, you are so strong. And you knew that you could say no. Unfortunately, the doctor that she got was not used to people saying no to him. And he was like, I'm going to teach her a lesson. And she didn't know how to handle that at the time. And he basically started saying things like, oh, well, because your baby's premature and everything, and your baby's underweight, we need to take the baby to the NICU. And she's like, why? I'm breastfeeding and she's doing fine and she's thriving. And he's like, no, we have to take this baby to the NICU. And he basically he sat his foot down, and he had his political power within the hospital, basically doing the horizontal violence, which is when people within the same industry, like the nurses and the other doctors who might stand up against him, are basically beaten down, not physically, but like with fear of reprimand. So nobody was speaking up against this guy, and it was just absolutely horrifying. And on top of that, now she's afraid that CPS is going to come in and try to take this baby. Like, this is basically medical kidnapping. And he comes into her room and he says, well, you can go home if you really want to go home, but you're not taking that baby. And again, she didn't know her rights. So when she comes to me, it was after I had done this interview for the TV news story, in which I had been asked, what is your comment on the maternity care? Because a mom had been turned away 3 times saying that she was going to have her baby. And they kept saying, no, you're not in labor. It's too early, go home. And then by the last one, she ended up coming back and birthing in the hospital lobby. And I had been asked, well, what are your thoughts on that? And I said, I'm not surprised by this, because our healthcare system, especially in this area, they don't listen to women. So she found me on Facebook and she's like, Carly, I need to talk to you. Like, I don't know where to go for help. I've had this absolutely traumatic experience in the same hospital that you were talking about, and I just don't know where to go. I have no resources. I have no idea because I just moved here and I don't know where to start and I need to talk to you. Like, okay, we'll be on the phone. And I talked to her for 2 hours. And she has given me permission to share a little bit of this story because she just wants the word out. She wants people to know that this is happening and that it's not okay. And so I basically, what I told her first is I listened to her story, because this is what I do, is I listen to a lot of traumatic stories. And over the last 9 years, I have been listening to these traumatic stories. Well, almost 9 years. My son turns 9 in May. And I've been doing birth advocacy since he was about 6 months old. So I listened to her and I told her, it's like, look, it's not your fault. It's not your fault. You did everything that you possibly could. You advocated for yourself. She did a few things that were surprising, that were also like, way to go to take that step without actually having somebody tell you. And I will be sharing that with you as well, because this is all about, where do you go after you've had this traumatic experience? What do you do first? Well, the first thing I told her is like, look, you have just been through the ringer. And you even had the threats of CPS, like before you even file a complaint, before you do anything else, because it is going to be a fight, especially with this hospital, in this health authority. And it's going to trigger the hell out of you if you don't go and heal first. So I told her, it's like, first, I want you to take the weekend off. You're going to take some time with your kids. You're going to spend some time and you're just going to just relax. Okay. And then the next step after that, I'm giving you the number of someone who does local trauma therapy. She's amazing. And she can help people get past a lot of their trauma and their triggers and deactivate them within 4 sessions. The name of the technique that you really want to find someone who's knowledgeable and can do it very well, it's called EMDR. Basically what they do is they do a lot of tapping. So you're thinking of the memory and then you're doing some tapping. And then some of it is like, she actually had like a tool, and then she would like, I would be in my zone and all of a sudden like she would be tapping on my hand with this tool. And she really worked through a lot of my fears. It only took me a few sessions. And my lovely, lovely Jenny, I cannot say this enough, but Jenny also saw her and she had something terribly traumatic happen to her, and it only took 4 sessions. So you really want to have that therapy. You need to have it, because if you're going to go and file a complaint, if you're going to heal, if you're going to even go on to be able to be the best parent you can be for your child after trauma, you have to heal, because otherwise that trauma will pop up in other areas of your life. So that's what I told her. I said, you need to take some self-care today. You need to do something for yourself. You need to connect with your family. You need to snuggle that baby. I told her, it's like, you go take that baby, you snuggle her skin to skin, you be that safe space for her, because she's been through a lot of trauma too. And you guys just take that time to just be together, and then we'll work on everything else. It doesn't all have to be at once, and it's less overwhelming that way. And you're most important. The most important person is you right now. So that's what I told her. The next thing I told her, of course, is like, after we're done that, after you have seen the trauma therapist, we're filing that complaint. And I actually am friends with a patient care advocate, and she understands more about the workings of the Lower Mainland where I live. But the basic thing is that if CPS has been involved, which in this case it was threatened, and this particular hospital is also, because they're in a lower economic area, they do tend to see a lot of drugs, and they do tend to see a lot of like really bad situations. So they biased against her based on a few attributes and then made up the rest. But because they're working within that, they're also very trigger happy. So it's very likely that they might just keep seeing her resistance as non-compliance, and then they might actually try to do something. And that's actually illegal, first of all, but that threat is still there, and it's still a waste of our healthcare resources and our social worker resources, and it just adds stress to the family. So before I get into that, and I'd love to, but I was actually on a call earlier today with someone who knows more about CPS, specifically in her hometown of Atlanta, but she also understands like the entire healthcare system for the US, and it's very similar here in terms of CPS involvement. And her mother actually happened to be a social worker. So she's got a great insight, and I'm going to be having her speak next week. So if you're wanting to know more about child protective services and how that actually ties into wanting to have an unassisted birth at home, or just choosing not to go for certain medical things, or if the healthcare provider is threatening to call in CPS because of your non-compliance, she has a really good take on it. With a patient care advocate, my friend Connie, she said because of the fact that they're threatening CPS, the best thing she needs to do, because they did bring in a social worker, even though it's completely useless, is to file the complaint that the social worker suggested through the patient care quality office. So if you ever have a social worker come into your room and ask you to file a complaint, you still file that complaint, because that's what they're expecting you to do. One thing about that though, because my dad actually has a social work background and a mental health background, is that even though those things are set up, oftentimes the different systems don't really talk to each other. So you may be advised to go and file a complaint with something, or to go and seek health services or mental health services from somewhere, only to find out that it's not really the right avenue and it's not going to work for you. That is something I see quite often. It's like, well, I was referred to this for postpartum, and it turns out that they don't have anything. What do I do now? Well, my dad actually is like, he's usually the last nurse standing, and he will direct people to the actual places. So sometimes it helps to have someone who knows more about where you need to go. And if you're outside of the Lower Mainland, of course, you're probably going to want to start figuring out where those resources are. And sometimes it's as simple as talking to somebody who happens to be in that industry. That is how I get a lot of my information now. It's like, hey, Dad, you're a nurse. You're a mental health nurse. Can you tell me what is being said to moms postpartum and what you would really recommend? And then he tells me. Or I talk to Connie. Hey, Connie, you're a patient care advocate. This has just happened. This has just landed in my lap. And what do we do here? Then there's so many different avenues, but you do want to file that complaint just so it's on record, because they expect it. It's stupid. It doesn't actually do anything, and you still need to do it just to, basically it's paperwork. It's the red tape. You just need to go through the check boxes and the red tape, even though it's stupid, even though it does nothing, because they think it does something. They think that little tape or rope is attached to something, and it's not, but they still expect you to grab it. So you file that. And then the next thing you want to do though, is you really want to brain dump, because you cannot write an effective complaint letter to the right place that you want it to go until you have processed what's happened. So that's why I say you need to take care of yourself. You need that self-care. You need to be able to go and get some healing, get some therapy, trauma therapy. There's Reiki healing. There's closing ceremonies for postpartum to try to recreate your birth and heal the way that you need to. There are so many different avenues. Sometimes it helps to just have somebody to listen to you as you share your story, and to really be like, wow, like, yeah, I'm validating your feelings right now. You are actually right. It's not okay what happened to you. You're loved and supported. And often this is what I do, is I'll sit there and I'll listen to a story. And my intention is, after they're done sharing their story, I'm going to leave them better than when I found them. I don't want to leave anybody broken. So anybody who comes to me, they come to me broken, and I leave them in better condition than when I found them. And at the end of this call, this 2-hour call that I did, and then at the end of it, she's like, I have hope again. I feel lighter again. Like a weight has been lifted and I feel that hope. Thank you. And it's like, all you did was reach out. And I'm just here to help you and get you back on your feet. So yeah, you need to do your self-care. Self-care will help you heal. Going for the trauma therapy will help you heal. And then by helping you heal, then you can do that brain dump without getting triggered, because you're going to dump that entire story. And if you don't get that help first, it may take you much longer to write out that story. In fact, it took me about 3 days to write out Hunter's story, and I didn't know why at the time. I'm like, this should be easy. Why am I getting triggered? And it wasn't until after 2 years later, when I finally went for that trauma therapy, that I was able to revisit that story and go through it and then write my complaint letter. And I still did some things wrong that I've made some mistakes, and I've now learned from them. And I'll be talking about that too in just a minute. So once you've brain dumped, you want to take another break. I do not want you going and brain dumping that whole trauma and then jumping right into the trauma. So you've done it. You've let it out. Now you take a step back and you do some more self-care, and you do any of the exercises that you've learned from the trauma therapy to keep yourself grounded, because you need to be able to come to that story again from a place of power, so that you can look at it from almost like a bird's eye view or an outsider's perspective, to start picking out what is it that you really want to complain about. Because you want to take all of the emotional trauma out of it so that it makes sense, so that you can then go and create a complaint letter. And I wish I could teach you the full process of the complaint letter. But this is something that I feel that when somebody else has a zone of genius, it is easier for them to teach it than it is for someone who has done it, knows the process, but hasn't done it to the exceptional level of that genius. And while I'm really good at doing a complaint letter, and I was really good at teaching it, the one who took what I taught her and then went one step further to make something so phenomenal that it got the attention of the health authority within 2 weeks, and they immediately wanted to get on a call with her to discuss it. Like, that is huge in our area. That's Jenny. And if you want access, there is a little bit of an investment, but it's under $50. And she's going to teach you her entire process on how to write that complaint letter. But before you write that complaint letter, you need to do that mindset work. Jenny even said that it's important to do that mindset work and to basically put yourself in a position of empowerment before you even try to tackle it. So full disclosure is, before Jenny wrote that complaint letter, what she did is she came to me and she said, look, I need help with birth trauma counseling. And so I did the same thing that I did with this mom. I told her to go and see Paula, my friend, who I saw as a therapist back when I needed birth trauma therapy. And I continue to send people to her because she's just that good. And I said, go see Paula. And Jenny went and saw Paula, and she was feeling better. And then she's like, you know what? Like, I'm not at a place where I want to have another baby, but I do want to help you. And then that's when we created the Empowered Birth Workshop back last April. And then from there, after going through the workshop and learning from me and healing herself and really working on that mindset, she's like, I think I might want another baby. And then we continued to work together. And now by September, she's like, I think I'm going to move up my timeline, and I think we're going to start trying now. And Jenny's pregnant now. And she is just navigating this healthcare system, even though there's so many restrictions on VBAC. That's not stopping her, because she knows her body can do it, and she knows that she has the power. And in addition to that, she had filed her complaint letter and she got it read, and she's just in a much better place. She's even building a birth house network. So she's just, from healing, can do a lot for you because it puts you back in that power. All right, that's all I have to say today. I love you. Go be empowered. Bye.